And we are live once again. Hey, everybody. I'm Dr. Jerry Cartznell. I'm a board certified pediatrician and taking care of children on the autism spectrum now, probably going on over 30 years. 20 years, just kids on that darn spectrum, along with other children with neurodevelopmental disorders, complications, things that other doctors are having a difficult time trying to figure out or don't want to figure out what's going on with them. One of the hard things to figure out are stimming behavior. So we're going to talk about stimming behavior today. And I want to look at it as something that is coming more from a medical concern, a manifestation of something that's going on inside of them that we might be able to control. It seems that, and again, if you look, there's not very much studies on this particular issue, but stimming from those who can communicate to us why they do it will tell you that it's a way of settling their system, whether it be anxiety or pain or the uncomfortableness of a social situation or demands being placed on them that they don't feel comfortable with. So like anxiety, it's a self-calming kind of behavior. And they'll tell you that if I need to stim, I need to stim, so please don't interrupt that. And then as they get older, they realize that they can stim, bounce, whatever they need to do in a more private place, so it's not a public demonstration. And they'll tell you that they feel awkward stimming in public, but they may have to go to the seclusion of the room or a bathroom or the airplane bathroom and do some stimming to chill themselves. So our goal might not always be to totally remove stimming, but be able to move it into a way that it's where it's more socially acceptable. Speaking of socially acceptable, this is my son David. He's just saying hi and making sure that I'm going to be able to get your texts. So I was looking, or actually I was thinking this morning about all the stims that I see, and this is not going to be certainly a comprehensive list. In fact, you guys are probably going to email me, well, what about this? What about that? I'm going, well, those are stims too. I just hadn't thought of it. So I thought when I was making my list, I would start from the eyes and move my way down. So when you think about stimming and the eyes, what I've seen is this scoping, where they kind of look at things down. They look at lines. They just kind of look at corners, but they're looking on the corner of their eye, and I call that scoping. Or they can stare. They can squint. Okay, they start squinting, and sometimes they have little fingers in front of them. They may flick their fingers in their eyes, or they wiggle their fingers in front of their eyes, or wiggle them on their side. But there's always something that's in their peripheral. Picking eyelashes. Now I'm going to move that out of more of a tick, but it could be a stim. That manic pulling of eyelashes, hair, that might be something different. Mouth stims, of course, we see smacking, spit play, spitting, gum picking, where they're actually picking their gums and doing great damage to the gums. Licking, that's a big one. Tooth tapping, chewing on fingers, biting fingers, chewing on things, grinding teeth. Okay, these all manifest as stims. Nose smelling, smelling armpits, smelling anything, shampoo, hair, they're always smelling stuff. Ears, we've seen fingers in the ears, not necessarily blocking out sound or sound disturbances, but they're stimming on their fingers in their canals or covering their ears. Vocal stims, whoa, we got a lot there. Of course, the E's that we've heard, motor noises, the pterodactylus screeches, squawks, singing, verbal chitter-chatter, scripting, that kind of stuff. Fingers, I've seen them make some really weird contortions, or flicking, finger licking, spinning objects. Boy, I've had kids do the most amazing spinning of things, but that's the stim, okay? Jumping, of course, getting gross motor, jumping, toe walking, rocking, Stimming on one's privates. That's a difficult one. Lining up things, as my son used to do, lining things in patterns, red, blue, green, red, blue, green, red, blue, green, or following the rainbow or something like that. And of course, one of our favorites, stimming on electronics, whether they're stimming on their iPad or the phone or something, or TV or Teleguppies, but they're stimming. Then they can stim on others. They can stim on mom's hair, hard neck hugs, hugging. It's not for affection. They're using mom as a stim toy, or dad or the person as a stim toy, something else to stim on beside themselves. So why the stims? I'm thinking they're trying to do something to mitigate their sensory overload or pain or infection or something going on inside of them, and they're just trying very desperately to do something, anything, to block the amount of information coming into their brain from a particular part of the body. They may do it as a way to adapt to an unfamiliar environment, a new situation. I'll see them when they come to my office with an extra dose of stimming until they get comfortable here. They probably do it, as I was saying, my older folks who communicate, as a way, a mechanism to reduce anxiety or just that internal stress of a situation, kind of like a margarita or two for some of us, or a glass of wine. It's a way to express frustration. They'll stim when they're not happy with you and you're doing things that they're being asked to do things that they don't want to do, and it's kind of a communication in some ways. Doesn't mean that they get to do work avoidance because they don't really want to do what they're doing, but it's kind of reason. And of course, to avoid certain activities or expectations, and they'll stim in classrooms. I mean, they'll go anywhere with their stimming behavior. All right, now what do they on the internet say to do to treat this? You'll like these things. Like, see how that works for you. Intervene during any unsafe behavior. Have you ever tried to intervene them with them self-injurious, injuring their head or something like that? It just makes them even more wild. Not saying that you can't do something, but you just got to be careful how you intervene there. They say to treat by advising other family members how they can help, or reinforcing acceptable behaviors and ignoring the unacceptable behaviors. They're stimming because they want to stim. It's not unacceptable to them. So if you want to walk out of the room while they're stimming, they're fine with that. Okay. I like this one, creating a safe environment. In other words, the reason your kids stim is because you have them in an unsafe environment, and if you would just make it safe, they will stop stimming. I wish, right? Okay. That ain't going to help. Suggesting alternate activities that provide the desired effect. Okay, so that's called redirection. And you can spend almost every minute of every day with some of these children trying to redirect them. And it works for 15.3 seconds, and then they go right back to their stimming behavior. I like this one too, teaching them self-management tools. Who are they working with? The kids that I have, you're not going to be able to teach them self-management tools. So those are some of the things that you might see out on the internet, moving them into a stress-free environment. Yeah, wouldn't we all like to move into a stress-free environment? Like, that's going to happen. All right, so where are some of the stims that I commonly see in my practice? And we can go through this list and talk about each one. But for example, when I have children who are grinding their teeth, we call that bruxisms. That's always something, or almost always something, in the bowels, whether it be constipation, bacterial dysbiosis, parasites, but something's going on in the bowels. When they grind their teeth, that's a way that they try to manage bowel pain. And it could be the wrong foods, it could be dairy, it could be gluten, it's the bowels. And that's where we got to try and figure that out. And then, of course, then I have some kids who only grind their teeth at nighttime, or they transition to sleep. Then you're wondering if that's anxiety because the bowels are clear. So that would be one thing. Another thing is, are they getting the wrong foods? Too many carbs, too little protein, fat, or fiber. Too many carbs. I had a kid this week, it was just amazing, that when we removed the rice, and this has happened before to me, or actually this child was all the grains. Once we removed all the grains, the stimming stopped. Okay. I had another child last week who was spitting like a viper, spit, 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 spit. And when we removed Humira, the child had been put on Humira by the gastroenterologist to help with inflammatory bowel disease, but that triggered the spitting stim, and that was driving me nuts trying to figure out where did this spitting come from. And when we stopped the Humira, the spitting stopped. So we have to think about, are they getting too many carbs? Are they getting the wrong foods like grains? Do we have to go grain free? Are they on a medication that might make them stimmy or pain or whatever it is? And that can go for licking too. Sleep deprivation is another big reason why kids will stim. They don't feel good during the day because they didn't sleep well last night. Kind of like all of us. If they're not sleeping well, us parents aren't sleeping well. And so many of them are communicating that they need help with their sleep hygiene, their sleep mechanism. And then we have to work on sleep. So I'm going over some of the common things that I see that can alleviate that. Hormone imbalance is another one, whether it be again, too many carbs and too much insulin, and then you get the rebound hypoglycemia, or there's a cortisol problem, or one of my favorites, too much adrenaline is being released, and they're in a fight or flight mode all the time. And that will cause them to try to bleed off that excess fight or flight with a stimming behavior. Another one that I see very often that leads to I guess what you're doing right now is you're putting together that there is a cause and effect. And if I can figure out the cause, then I won't have the effect. Another reason for stimming would be constipation or inflammation or gut dysbiosis. So we treat the yeast, we treat the parasites, we treat the constipation, or the diarrhea, the chronic inflammatory bowel disease that I see so many kids have. We fix those, and a lot of the stims disappear. Okay. So that's really good. Sometimes it's an amino acid deficiency for my kids who are not eating protein, and I have to put them on amino acids, or it's a mineral deficiency like zinc or iron or selenium, molybdenum, magnesium, or a vitamin deficiency, vitamin D, B12, my methylation pathway people who are not doing well. We might not be getting enough of the micronutrients too, and we have to think about copper and folate. We're getting too much of those, too many trans fats or omega-6, too much. We're trying to do something, but we're kind of overcorrecting. What about exercise? So many of my kids won't exercise. They do so much better if you can get them out and doing some exercise. I've never heard that when my child exercises, he's worse. Never. It's always he's better, and he either sleeps better, he's more, it's kind of like, I've never heard a child who's constipated that when he has a bowel movement, doctor, he's worse. No, he's much better after the bowel movement. And that's kind of a big clue for me that if we can just get the child having bowel movements or exercising. And then of course we can think about issues with the biotoxins, where it be mold, or we have the methylation pathway defects, and we need more glutathione to help clean the system, or charcoal or bentonite clay, or if it's mold toxins, cholestyramine. But there's something that we need to do more to clean the effects of this. Another one that I get frequently, and it hurts the left side of my brain, I can't figure it out, is when we turn off the home Wi-Fi, my child doesn't stim. So I hear it enough to mention it. My problem with that idea is that if I turn off my home Wi-Fi and I use my phone to see what other Wi-Fis are available, there's like 15 other in my neighborhood or this office. So why would turning off my Wi-Fi when I'm getting everybody else's Wi-Fi affect my child? Well, probably the strength and the proximity and the locality. And then if you go even further, the electromagnetic fields that are in the house, and these are, they've got these little meters you can buy on Amazon and see if your house has a ton of electromagnetic fields, or at least in the child's bedroom. And if you flip the circuit breaker for the circuits in that child's bedroom, they sleep better and their stimming goes down. So there's still apparently a lot of research that has to try and help us figure out why that is a problem, but I can tell you with a certain group of my kids, it is a problem. Whether I want to like it or not, turn off my Wi-Fi, turn off my house power, but it can be dramatic, just like changing the foods and changing the constipation and the diarrhea. All right, so that's what I have for you on Stims. It's kind of an interesting topic, and I'm sure that I did not list all the Stims that are out there. Those are the ones that came to my mind this morning as I was preparing for this conversation with you. But Stims can get in the way of learning. They can get in the way of socialization, and it can rob the child of joy, because I really think there's a big group of kids, they wish they weren't stimming, you know. Like for example, I had one child who kept spinning like a top, and I treated him with metronidazole, thinking this might be a Clostridia infection in his bowels, and he said, "Mommy, my brain is not making me spin anymore." So he's communicative, but he just couldn't stop spinning. And as soon as we got rid of the Clostridia toxin, whatever it was creating and causing him to spin, then he was able to settle down and get back to enjoying our life. The quality of life improved dramatically. So I think it's very important that we search for medical causes that could be contributing to the stim behavior that we're seeing. All right, let's see if we've got any questions. Kai asked, hi Kai, is the IgG allergy test accurate? It is, to a certain degree. It's going to give us a clue whether there are certain foods that are potentially problems for our body, for our immune system. And the IgG is different than IgE. IgE gives us that allergic reaction that we associate with hives and itching and sneezing, coughing, and of course all the way to anaphylactic shock. That's the IgE reaction. IgG is still an antibody, IgG, antigen, whatever we're sensitive to, response, and it too can release cytokines and interleukins that are inflammatory. And whenever you have inflammatory mediators circulating through your body, they're going to affect the brain, and that will give us a fog and irritability and that whole cascade. And then you can get into issues of chronic inflammatory response syndrome, and it's a pain. The key, though, for me is that it's a idea of where in the pond I should go fishing. Am I going to get a bite over here? So if I've got high levels of IgG to certain foods and I remove them, then of course what do I want to hear? I want to hear the child is better. Okay, now just because the allergist can't explain it, just like I can't explain to you why EMFs are causing kids to stim, but you remove them and they do. Just because I can't explain it yet, the science isn't there. The result is you can't deny the result. So we start with the IgG panels because they're a blood test, and you don't have to have the multiple prick tests. And these tests that they do at the allergists are IgE mediated, and the kids don't have IgE. Now they're coming around. It used to be just a few years back that if it wasn't IgE mediated allergy, it didn't exist. They did not see the IgG connection between behaviors and bowel issues. Well, now they do, okay? But back then they didn't see the connection between leaky bowel, and I couldn't believe it when the American Academy of Pediatrics wrote that in one of their GI supplements about leaky bowel. So it's like, and of course they think it's their idea, and us functional docs have been saying this for years, but that's okay. They're coming around. So I think the IgG is a good thing to do, and that's where I start with just about all my patients if I'm suspecting that there's a food allergy. Now, if you have a child who only has 5 foods and they will not eat any other, it's silly to get an IgG panel because you're going to find that they're allergic to those. If I have a child who has multiple foods and I can actually remove some of them, like corn or rice or whatever, because they have IgG positive, then it's a good thing. Okay, so that's from Kai. Joy writes, hi Joy. What did you write me? You said, what is the best treatment for C. diff infection? It's actually not the best, it's the bestists. In other words, getting to move their bowels daily is a huge part of it, because if you can move 90% of the C. diff down the toilet, how cool is that? I use either Alinea or metronidazole for the Clostridia eradication, and then I have to put them on a different type of a probiotic, okay? And I like the Orthospore IG right now for keeping that Clostridia from coming back, because it puts itself into a spore mode, and while you're on antibiotic, it kind of hides in one form that the antibiotic can't kill, and then once the antibiotic's gone in 10 days, it kind of looks out and says, oh, the coast is clear, and starts making babies, and then you're right back in the same soup that you were in before. Did I mention getting the bowels cleared? You have to move your bowels daily. Twice daily would be a great goal. And you need to be on probiotics. And the one I like is the Orthospore, because it's got this immunoglobulin as well to help fight infections. And I could put them on silver. I could put them on grapefruit seed extract. It just doesn't seem to work for our kids too much. But we definitely need to make sure that we're doing everything we can to inhibit the growth of Clostridia. We can talk about the FMT. It's not available 98% of the time in the United States. You have to go out of the United States to get the fecal microbiota transplant, but I've seen that not work or actually make things worse. I have a kid right now who got the FMT, and they're much, much worse. We have to try and figure out what tarnations is going on there since getting that. Okay, Natalie writes, what would you recommend Restore to help with yeast overgrowth? So we're talking about is a probiotic. I think we can try Restore. It's a good probiotic to see if that will help, but the proof's in the pudding. And the idea is that we have to find the right probiotic to help minimize the regrowth of yeast, whether it be a probiotic that has Saccharomyces boulardii in it, which too is a yeast, and we're not supposed to be sensitive to that particular yeast, but it makes toxins that kill other yeast. So you're using chemical warfare, one yeast species that's supposed to be non-toxic to us, killing all the yeast species that are toxic to us. It's a great idea, and it's been used for years, and with some good success. So I think that's a good place to go too. Remember, ultimately, what's going on here? The immune system is supposed to keep yeast under control. That's why when you were 5 or 6, or when I was 5 or 6, and we got a soda, or we got some grape juice or something, a cake for our birthday, we didn't overrun with yeast, because our immune system knew how to keep it in check. Unfortunately, a lot of our kids' immune systems welcome yeast. Come on in, come on over, you're welcome to grow here. And I can come in there and swat it with, say, nystatin or fluconazole, and they just come right back. So trying to find a probiotic, trying to find a regimen that keeps the regrowth, the repopulation under control is always a good idea. So that's a good question. All right. And then Angie says, hi. Wow, I'm getting lots of questions here. All right. Let's take these in order. Deanne says, how would you detox a 6-year-old from heavy metals? Well, good question. First of all, what heavy metals are we detoxing? Because certain chelators have certain affinities, greater affinities for one particular heavy metal and not the others. So I'm going to pick one thing for mercury and another thing for lead. So we first have to measure what's going on in the body. So I tend to do what's called a DMSA challenge. And I grab urine for 6 hours from the child. So say a Friday from 9 a.m. to 3 p.m. And that child may pee 4 times during that period, or 6 times, whatever it is, I got that urine. And I send that to the lab. Saturday, I'm going to collect the urine the same time, 9 to 3, except at 8 in the morning, I'm going to give something called DMSA, which is a chelator. And I'm going to also give it at noon. And then at 3 o'clock, our collections over. I'm going to send that to the lab. Now the lab's going to do a report and send it back to me. Urine without a chelator has this much mercury, this much lead, this much arsenic, or whatever it is. And I can compare the two. Did my chelator move anything? And if it moved, say, primarily lead, I'm going to use EDTA. If it's mercury, I'm going to use DMSA. And then, of course, supporting things to help facilitate the removal of the heavy metals. But I need to be able to see what I'm chelating. Now, I started chelating in the early 80s because back in those days, children were eating lead paint. So we still had lead paint in the inner city buildings, and it would curl up on the windowsills. Kids were hungry. They'd pop it off and eat it. And interesting, lead paint tastes like chocolate. So if you have a hungry child and you got lead paint, they're going to eat it. So we were chelating in the 80s, lead all over the place. And so I think it's a good idea to find out what you're chelating and not just say, oh, this spray or this juice or whatever chelates all metals. And how do you know? And what am I chelating and what am I done? So I'm going to do a little more science behind that one. Good question. Christy. Hi, Christy. Is the orthospore good for all people or just those diagnosed with C. diff? It's not, nothing is good for all people, not even a cup of coffee. But I will use that for more of my inflammatory bowel disease kids or my kids with C. diff. We have a general probiotic here that we tend to use, what I call probiotic gold. That's a great probiotic if we don't have any of those significant bowel issues going on. Okay. Natalie writes, oh, hi Natalie, thank you. Let's see, enjoy, back again, thank you, you're welcome. Ion's writing back again. If there is a yeast issue, is it safe to do antifungals without probiotics until weeks later? Okay, good question. Let's get this straight. Probiotics are generally healthy bacteria. Yeast is a fungus. The antifungals do not affect the bacteria, and antibacterials don't affect the yeast, unless make it even easier for them to grow. So antibiotics can actually facilitate yeast growing, but they don't kill them. Okay, so you can actually use a probiotic, good healthy bacteria, along with your antifungal. Okay, we have these things called bacteria, and we have yeast, which are part of the fungi group, like mold. Okay, of course we have viruses, and then we've got some other little critters like parasites that are growing, and there's even some other little things that we can get infected with in our bowels. But basically it's the four things: the parasites, the viruses, the bacteria, and the fungi. So if I'm killing fungi, but I also want to kill some bacteria like Clostridia, I can do them together, like peanut butter and jelly, or vice versa. So we can do multiple things at the same time. Problem is, if the child starts having a bad reaction to it, then we have to stop everything and say, was it my antifungal that I picked, or is it my antibiotic that I picked? And I bring one in at a time and do that. And then if that child's doing okay, then I bring the other one back in. Because what we may also get into is a die-off reaction, and that can cause behavioral problems and issues too. So we want to try and stay away from that as well. Good question. All right, now I think that might be all of our questions for today, because you guys are great and I don't want to miss anything. So if you did write me a question and it's not here, just let us know and I'll make sure that I answer that next week. So I hope today's discussion on, well, bacteria, viruses, probiotics, stim behaviors, and the causes of stim behaviors was helpful for you. And I'd be interested if you have some other stims that I haven't spoken about, let me know and I might target what they may be due to. In the meantime, have a wonderful week. It was a pleasure as always to be here and bring to you some interesting topics on autism. And if you have an interesting topic, make sure you email us and we'll put that into our schedule and see if I can't talk a little bit more about it in depth. Have a wonderful week. Love your kids, and it's been a privilege having this discussion with you guys. Take care.